Well, what I found was a very, I would say, apparent calm when you arrive. But then you realize that it's only an illusion because there is peak of violence like your colleague just described. And when it happens, then chaos happens. And then when I was there, there was like every day airstrike. And we had patients every single day coming in my emergency room being injured, either with shrapnel wounds or with burns from a bombshell.
As we talk, I'm going to get some shots up here so our viewers can see some of the work that some of your colleagues have been doing on the ground in Syria. Is this a humanitarian crisis that is getting worse?
Well, what is worse is the fact that it's been going on for a long time and that we are seeing slowly a collapse of a health structure going on. There is insufficient aid inside Syria. There's insufficient actors to respond to the humanitarian medical needs. And the other major concern is access. The access to, for patients to go to healthcare, and then the access for aid to come in. And one of our biggest concerns is that we know that at one point the international community has mobilized itself to get access for some specific things, like when the chemical weapon UN investigator came. And we really wonder why we're not having the same political will for humanitarian aid.
For similar corridors, as it were. I know that you've talked before about treating kids following an attack in which a barrel bomb, for example, was dropped on a school. How difficult is it for a doctor like you to cope under the sort of circumstances that you've been in when the medical facilities are extremely limited, where the people are obviously in need of an enormous amount of help, like you suggest, that just isn't getting in?
Well, the thing is, it's the fact that patients come, and they always come in not one by one, but a pack of them, and then you are easily overwhelmed. And then you know that you can go to a certain level. And where I was working was a field hospital of 25 beds, and we are treating patients with 30% burn of the body. And then the 4 children we've got, 2 of them were above 40, and then we send them to another hospital, and one of them died on his way because the burn was so extensive. And then the thing is, my heart of a pediatrician is saying, you know, we cannot bomb children. This level of violence on civilians is way beyond what is acceptable.
We talk about a population of some 30 million, some 7 million affected by this. We're talking about a quarter or more of the population. But when you hear numbers of dead at around 129,000, sadly, sometimes I wonder whether those figures are accurate. When you see the sort of stuff that you've seen on the ground just in Aleppo, can you imagine the numbers of dead going higher dramatically across the winter if this continues?
Well, I will hope not for that, but I cannot predict the future. But while I was there, there was so much number of attacks that I wouldn't be surprised that the number would still be climbing up. So.